Hi guys, in previous video we have already seen the live case of Raynaud syndrome. So now we'll discuss everything about the Raynaud syndrome. So Raynaud syndrome is nothing but it's an periodical or the episodic attack of the vasospasm that causes the closure of the arteries or the arterioles, that is distal capillaries, that to distal to the extremities. So we know what are the extremity distal part of the extremities includes, it may be a distal part of the hand, that includes the distal of the fingers, and for the foot, and one more thing, the distal part of the body includes even of the tip of the nose and the ear lobes. So these all end organs or the extremities or the last part, which is small, which contains supplied by the small arterioles or the capillaries. So what happened in the case of Raynaud syndrome? In case of Raynaud syndrome, there will be a periodical or an episodic attack of the vasospasm. Because there is a vasospasm, there will be less blood supply and there will be closure of these end arteries. As there is a closure of end arteries, it will cause some clinical features that include discoloration, pain, and the rest pain, and severely in complicated stages, it may cause some ulcerations, that is non-healing ulcerations. So this all condition is called as Raynaud syndrome. So what are the causes in the Raynaud syndrome? How it forms? Even we know in definition only it is a clear cut that Raynaud syndrome in case of some, because of some any external effects. So we'll discuss the causes. What are the causes? In case of some the patient who is already a chronic tobacco user and a chronic smoker, in this condition, or the person who was working in the drill workers. What are the drill workers? Nothing but vibrating instruments. So what are the vibrating instruments? We can already seen that there are some people who are involved in the workers of road construction. They used to break that road with a vibrator machine. Because of continuous use of that vibrator, there one cause. One more is patient is already having smoker and tobacco user, tobacco chewing, and one more is there are some external any trauma, anything to the limbs that may cause an small reduce blood supply to the small arteries. This is one type. One more type is there are some conditions which will cause this Raynaud syndrome is seen because of those conditions. So what are the those conditions includes, there are some autoimmune disorders and connective tissue disorders. So what are the connective tissue and autoimmune disorders that causes the Raynaud's phenomenon is, one is systematic lupus erythematosus, that is called as SLE. One more is scleroderma. One more rheumatoid arthritis. One more then Jogger syndrome. So these all are the conditions that may cause an Raynaud's phenomena. And there are some drugs which will cause Raynaud's phenomena includes ergotamine drugs and some beta blockers drugs. So these all will cause the blockage to the small arterioles, that will cause Raynaud's phenomenon. And one more some special conditions that to includes workers. So occupational history is very important. As a patient is, we know already discussed that the drill workers continuously vibrating the hands, and which are the people who are working in the cold extremities and the cold season during ice, they continuously, there are some workers, their work is to put continuously hold on ice, cold materials. Because of this all these conditions, as they're continuously holding the cold ice pack, because of this condition there will be the reduced blood supply to the end arteries, and it will cause the phenomenon, that Raynaud's phenomena. So these are the causes and the understanding of the Raynaud's phenomenon. One more is, so what you have to do in this patient and how the patient will present it to hospital. So usually patient will present to hospital with complaining of pain and the discoloration of the end part of the, that is distal part of the hand. So distal part of the fingers, that may be in the hand, in the legs, and the tip of the nose and the earlobe. Usually most of the 80% of the patient, they will come to complaining with discoloration and pain of the this distal part of the fingers, as we already seen that previous video. So only thing is pain and the discoloration is the main character. So what are the clinical features? Clinical features include, in inspection there will be no any much difference. Yes, there is a differentiation, like patient is having discoloration. So how it form? Because of the chronic blockage of the arterioles or the capillaries, it will form a cyanosis here. So end part there will be cyanosis, and that first they will present with a pallor, that in continuously it will form the cyanosis, and it will come seriously discoloration. So a pink or the pale discoloration of the distal part of the hand with severe pain. This is a one clinical feature. One more sign is, you have to press that finger. If you press, there will be a reduced capillary refilling time. So and patient will have severe tenderness, severe pain, pain even after rest. If you are not doing anything also, it will have some pain, and that pain also more aggravated in the night. So in it is usually more seen in patient of females as they are working more in the cold. They will to put some vessels, everything, cleaning vessels, everything. What are the homemade workers, they will be more of females as compared to men. And one more thing is, it is also seen more in the patient of who are already using tobacco and the smokers. So this is a Raynaud's syndrome. And what are the treatment how to given is, there are some medical treatment and surgical treatment. In case of medical treatment, we can only give. So treatment includes use of calcium channel blockers. Any vessel dilators have to be used. So most important drug is nifedipine. Nifedipine is a calcium channel blocker. This is found very effective. Actually, usage of nifedipine with pentoxifylline is drug. This have better effective. It is 60 to 70% of the patient will cure by the use of nifedipine or the amlodipine with pentoxifylline. So this is a very unique presentation, because I have already shown in the only one sign to diagnosis, there is reduced capillary refilling time. This is very important. This have to be seen. And thank you.